Hello, everyone. Welcome to another episode of the Aunty Pharmacist Podcast. How have you been? I hope you've had a nice week, regardless of whatever situation the economy is in right now. Just give yourself some peace of mind. Do what you can and just leave the rest. Don't think too much about it. That is what I do anyway. So, I informed you on the Monday episode that I'll be talking today about skipped doses of medication and what to do in those situations. Yes, so basically that's what I want to talk about today. It will not take long because I feel like I'm coming down with flu. Yes, I can already feel that congestion in my nose and all of that. But trust me now, as a pharmacist, I'm doing something about it already. I will not let it grip me before I do the needful. Yeah. So hopefully when I do the next episode, I'll feel much better. Yeah. So skip doses and what to do about it. You know, a lot of times people skip the doses of their medications for various reasons. You see, from I don't really like how it tastes to I don't like how it makes me feel to I believe this dose is too much. Why should I take it three times daily when I could easily take it twice? All of those funny reasons, okay? And some do it unintentionally too, okay? So there might be other reasons as well that I've not mentioned. And that is why I'll be talking about it today. What you can do in case this happens unintentionally. Okay. I've tried to encourage you on this podcast on trying your best to take your medications and ways to make it easier for you. Okay. I've talked about pill organizers. I've talked about, the benefits of taking your medications to time. When you think of the benefits, you might be motivated to do it the right way, right? I've talked about talking to your healthcare providers about adverse effects, you know maybe they could switch you to something better, something that will not make you feel that way, or they could give you something to counter the effect. I've talked about all of that. Please listen to previous episodes. You gain a lot from them. Anything about your medication, don't go too far. Just go to Aunty Pharmacist Podcast on the various podcast hosting platforms and you see a topic that applies to your question. Believe me. And if you don't, just send a message to me. You know how now. Yes. Send a message to me and say, "Oh, I want you to speak about these things." I would do that. Yeah. That was a digression actually. I've started making call to action again. As usual. That's the work that we have taken now as content creators, right? Yes. So to those that skip their doses unintentionally, maybe due to busy schedule, maybe they forgot to set their alarms, or any other reason why they did not take it unintentionally. This episode is for you. And if you know somebody that is quite forgetful, they don't take their medications as they should, makes them spend more, please just send this episode to them. Okay, share it with them and let them listen. That being said, let's get right into it. What exactly do I mean by skipped dose or missed dose? It is when you do not take the medication at the required dosage at the required time that you were supposed to take it. Let's say, for example, you were supposed to take it every 8 hours, right? And you just remembered after like 10 hours that, oh, I was supposed to take my medication 2 hours ago and I was busy doing something, I forgot. That's a missed dose, okay? Or you were supposed to take it 12 hours ago and you just remembered. You were supposed to take it yesterday, you just remembered. Or you even skipped a few days, maybe because you were so busy and you got carried away with something. That is what I mean by skipped dose. Okay. What I do not mean by skipped dose is, oh, I'm supposed to take it 5 minutes ago, or I'm supposed to take it 30 minutes ago. Do you understand? It's still within an hour bracket. As long as it is less than an hour, you can't call that a skip dose per se, okay? Because that time allowance is still there. Do you understand? But if it's going to hours after you were supposed to take it, because dosages are calculated on the hour, then it is a skipped dose. 1 hour is still allowable, really, really, because the body has a way of compensating for this thing sometimes. And those that formulated medications, they have taken this into consideration. So it might not be specific or exact. That doesn't mean that after 8 hours, your medication is totally out of your body and there's nothing left. Do you understand? It's just something we call a maintenance dose. Gets to a level in your body, you have to top it up again to reach that steady state. Do you understand? That is why you have to take it at those intervals. So an hour or below cannot really be classified as a skipped dose. But if it's getting over an hour, going to 2 hours, 3 hours, 4 hours, and so on, up to days, then you have skipped that dose of medication. All right. And the thing is, there are many different medications for different conditions and different dosages. Okay. Most skip doses address those that you have to take every day for a particular period of time, okay, at different intervals, or maybe once daily, or every 8 hours, every 12 hours, every 4 hours. There's some like that, every 6 hours, even. Do you understand? It's those that have close ranges, close frequency of administration that are most likely to be missed. Do you get that the doses are most likely to be skipped? You see, the drugs that you have to take maybe twice weekly or once weekly, I don't believe that you should miss those doses, but it happens too, right? Because, well, it's not so frequently taken, so you might have taken your mind off it, which is why you need reminders. Set reminders, guys. And if it's calendar that you are used to, mark your calendar. Put it in a conspicuous place. Even the medication, put it somewhere that you'll be seeing it all the time. That will be a reminder. See, now I'm giving you tips already of how not to skip your doses. It's still part of the whole thing anyway. Yes. So I'll be telling you what to do in case you miss doses. Then I'll be talking about some specific medication because the same thing does not apply to all medication. The rate at which they are excreted or eliminated from the body are different. Do you understand? There are some medications that if you take today, they'll still remain in your system for days. There are some that if you take today, you will not even see the effect yet, except after a few days. Do you understand? First, for medications that you take frequently, like I said earlier, if you remember about 2 hours later after you are supposed to take the medication, take it immediately. That's the general rule. As soon as you remember, take it. If it is less than 2 hours or within 2 hours after you're supposed to take it, that's why I'm saying that it's not really considered a missed dose as at that time yet. So take it as soon as you remember if it is less than 2 hours, okay? At this point, don't bother, don't care if it's a drug that you should take before or after meals. Just take it as soon as you remember. If you don't have any food around you or you cannot get access to food, just take it. That's the priority, okay? But if you can get something to snack on at that minute, you can do that as well just before taking it. The priority at that point is taking the medication, okay? And at the dosage that has been prescribed to you, I doubt that the side effect will be that pronounced. But if you experience any side effect, you can note that as well to let your healthcare provider know subsequently. But I will let you know that side effects are as a result of continuous usage of medication, okay? Like the blood level that is continuously maintained. So at that point, the drug level is already reducing. You may not really feel that side effects like you usually do. Do you understand me? So don't bother that. I'm supposed to take food with this medication. No, I don't have any food around me right now. Just don't bother about that. Take the medication that minute. That is the priority. Okay. Now, for medications that it is insisted that you take on empty stomach each time, and you just finished eating and you remember that, I've not taken my medication, what should you do? Just wait about 2 hours. Do you understand? 2 hours after you've eaten, then you can take your medication. Do you understand that? Now, it depends on when you were supposed to take the medicine. Okay, let's say you were supposed to take it 12 p.m. Then you remembered by 3 p.m. after you've eaten. What should you do? Do not take it again. Take the next dose. Do you understand? On empty stomach. Because when you add that 12 to 3 p.m., it's already 3 hours. But if it's within that 2 hours bracket, or you just finished eating, you were supposed to take it by 12 p.m., but you finished eating by 1 and you remember, you can take it till 1 hour 30 minutes after that food. At least your stomach should have been almost empty by then. Your bowel should have been moved and empty. Then you can take it. I hope you understand all this. If that period is still within 2 hours, it even makes it better. Okay, you're supposed to take it 12 p.m. before food. You were so hungry, you took your food and you just remembered, I was supposed to take this thing before food. Now I've eaten. Just wait 2 hours. Then you can take it. Your bowel will be empty by then. Okay. So that also usually applies to medications that you take once or twice daily, every 12 hours or every 24 hours. Take it as soon as you remember, as long as the next dose is still a few hours away. But for those that you take more than twice daily, every 8 hours, for example, if it is more than 2 hours that you've taken the last dose, just skip that dose and continue with your usual dosage routine. Take the orders at usual times. Try as much as possible not to forget again, but skip the already forgotten dose. Do you understand? Okay. Please and please, as much as possible, never, never take a double dose of medications. Do not. Don't say, oh, I forgot to take this by 12 p.m. Now it is 8 p.m. Let me take double. Please don't do it. That will aggravate situations. It could cause overdosage, leading to toxicity, increased side effect. Don't take double dosage. Just forget the one you have forgotten and continue taking it as you should. But like I mentioned earlier, there are situations in which this advice will not apply because drugs are taken at different dosages, they are excreted at different rates from the body, they have different mechanisms of action. Drugs are different, for different conditions. Some conditions, even if you do not take your medication for a few hours, you can still be fine, or even a few days. But some, the minute you miss a dose, you will understand. Even your body will tell you. Do you understand? So those ones I talked about earlier, they're like general rules for most common medications that are not specific to some conditions. The likes of, okay, maybe paracetamol when you're taking your anti-malaria, you can do that. Some few antibiotics like amoxicillin, maybe for flu, for sore throat, you can do that. But when it's getting to specialized medications for some conditions, there are other ways to approach it, which I'll be getting to right now. So for these medications I'll be getting into, that is the ones for specialized cases. If you skip their doses for any reason, the first port of call, what you should do first is check the medicine information leaflet. You know those notes that they talk into the packages of the medicines. Check them. There should be information about skip doses there. Okay. Now, if you don't understand it, the next thing to do is contact your healthcare provider. Okay, just go and meet your pharmacist, talk to your doctor. They will tell you what to do. But well, I'm just about to tell you what to do in some of those cases. That doesn't negate the fact that you can still go meet your healthcare professional. Okay, so that at least they can corroborate what I'm about to tell you. Yes. Okay. Yes. The first is epilepsy medicine. Those are medications for epileptic seizures, all right, convulsions. If you miss a dose, take it as soon as you remember. You remember the 2 hour rule, right? Yes. Unless the next dose is due within a few hours. Okay. If it's a medication that is taken once a day, the forgotten dose should be taken as soon as it is remembered. But if it's one you take twice a day, you can still take the forgotten dose within 6 hours after it was due. Do you understand? That is, you are taking something every 12 hours and you forgot. You can still take it after 6 hours when you were supposed to take it. Let's say you are supposed to take it 8 a.m., 8 p.m. You were rushing to work in the morning and all of that. You were running later. You forgot. But you got to your office. Oh, and it was 12 already. I've not taken my morning dosage of this anti-epileptic drug. You can still take it as long as it has not reached the 6 hour mark. Hope you understand me. Yes, that is for anti-epilepsy medicines. Okay. Two, to the oral contraceptives. You know that if you miss the dose of your oral contraceptive pill, you're at risk of getting pregnant. And what to do depends on what type of oral contraceptive you're taking. If it is a combined oral contraceptive, how many pills you've missed, And when you miss the pills, if it is just a day skip dose, you can take it, continue taking it. But if it is many days, please go and see your healthcare provider again. You might have to supplement that with another form of contraceptive. Do you understand? Yeah, that is that about that. Then for warfarin, warfarin should be taken daily, that is every 24 hours, the same time every day. If you miss a dose, for example, and you remember before midnight, you can still take it. Something that you take, once daily, the same time every day. You now missed taking it that same time. As long as it is not midnight of the next day, you can still take it. But if you have now crossed to the second day, like I said, please don't take a double dose of warfarin. No, no, it can cause hemorrhage, bleeding. So what you should just do is take note of that missed dose, okay? Then tell your healthcare provider that I missed the dose of this thing yesterday, oh, but I've taken the one for today. Okay, they can help you monitor your platelet clotting and all of that to be sure that you're safe. Now, insulin. People with diabetes, either type 1 or 2, they take insulin at a particular point. If you miss the dose of your insulin, please don't take a double dose to make up for forgotten dose, because insulin reduces blood sugar. You can just go into hypoglycemic crisis. We don't want that. So what you should do is check your blood glucose level first to be sure that it hasn't spiked. Judging from that, you can then take the insulin. If it is very high, you might have to take the insulin at that point. But if it is not, you can survive on skipping that dose and taking the next one. I hope you understand. So this one requires monitoring first before you know the next line of action. Do you understand? Another medicine I will talk about, like a specialized medicine, is methotrexate. It is the medication used to treat some types of cancer. It is also an immunosuppressant. Okay, it should be taken once weekly on the same day. Do you understand? Every week. Maybe you take it every Tuesday. It should be every Tuesday. Okay. But if you miss the dose, if you forgot about it, you can take it within 2 days of the forgotten dose. You were supposed to take it on Tuesday. Now you remembered on Wednesday. I was supposed to take methotrexate yesterday. Oh, I forgot. You can take it that same Wednesday or even on Thursday. That's within 2 days. But after 3 or more days, please forget about the dose and wait till the next Tuesday. Do you understand? That is for methotrexate. Now, for Parkinson's disease medicines, Parkinson's movement disorders. Yes, your carbidopa, levodopa, and the likes like that. Missing a dose can affect the movement of the patient. I mentioned it earlier that there are some conditions in which if you miss a dose, your body will hear it. Your body will know this is that type of condition. Even a 30-minute delay could be very serious. There could be risk of neuroleptic malignant syndrome. Do you get? When you suddenly stop these medications, it is rare, but it happens and it is potentially fatal. You start experiencing stiffness, muscle twitching, shaking, agitation, high body temperature, like very high fever, increased heart rate, your blood pressure is unstable, there's confusion. It could even lead to coma. This could even happen if you take double doses of the medication as well. So, what you should do is if you forget, take as soon as you remember, okay? Then adjust the time to the next dose. Just follow that same pattern that I gave for the general case. If, for example, you take your dose at 8 a.m., 12 p.m., 4 p.m., 8 p.m., that is every 4 hours, right? At specific times of the day. I said that there are cases in which you have to decide what time with your healthcare provider. These are such cases. So you took your 8 a.m. dose, for example, then you forgot your 12 p.m. dose until 2 p.m. You now remember that, by 2, I was supposed to take this drug by 12 p.m. Or take it at that time. Then adjust the next dose to 6 p.m. and 10 p.m. I hope you understand. Yes, that's what you should do. If you are taking a once daily dosage, for example, you can still take the forgotten dose if you remember on that same day. But if you don't remember until the next day, like I said, 12 a.m., 12 midnight, forget it. Just continue your normal dosage for the next day. Do you understand? And if you are experiencing those physical symptoms, like I mentioned earlier, Don't, because of that, go and take that dosage directly like that. Just go to the closest hospital to you, to your healthcare provider, okay, and they will know what to do next. I hope you understand this one. The other peculiarities about other medications, there are plenty medications for different cases in the world. So the peculiarities are so much. That is why you should see your healthcare provider for peculiar cases like this. But when it has to do with your supplements, most supplements are just once daily. Take it as soon as you remember. But don't double, never double your dosage. That is just the golden rule. Or let me say there are two golden rules now. One, never double your dosage. Two, always seek professional advice from your healthcare provider. That is it. That is why it is advisable to get your medications from the same source. Do you get? That gives you access to your pharmacist all the time. You could have the phone number of the pharmacy. You don't have to always walk in there and ask questions. Just call, place a call through. If they are busy, there are social media platforms to contact them now. Ask on WhatsApp. I'm sure there will be somebody there designated to answer your queries. That's the best way to manage your medication. Oh. I'm already talking about medication therapy management, which will be another topic for another day. Okay, let me not spill all the beans here. And that is what I have for you today. I hope you've gotten value as usual. Please continue supporting this podcast. Continue to follow, to share, to subscribe, and do all of that. Follow on social media, like our posts. Yes. Thank you so much for listening up to this point. I know I said it was going to be short, but when you do what you love to do, time just passes by so fast. So I didn't even know it would take this long, but I know that you enjoyed yourself on this episode. Let me quickly go and take care of my flu before it graduates to something I don't want. Okay. Till next time, stay healthy and God bless you.